As intercourse does not lead to curvature of the penis, masturbation also doesn't lead to curvature of the penis. But before explaining that curvature is normal, you must have the detailed idea that extreme curvature can occur in conditions of peyronie's disease, congenital configuration of the corpora cavernosa, and abnormality of the investing or buccal fascia. But little curvature of the penis is a normal phenomenon. Even Eros, the god of love, may not have erection at a 90-degree angle. Little on the left, leaning on the left or on the right, may be politically correct, but physiologically normal. Little upwards or downwards, penetration will not be affected. While breaking in through a window, one could be a little to the left or to the right, it makes the least difference in entering. The result is one gets in. So, this is something which one must understand. This is very simple. Then we talk about the cross section. There is a cross section of the flaccid penis, and the other thing is the cross section of the erect penis. Everything depends upon flow of blood. If there are two tubes of the similar diameter, from one water is flowing, another honey, which one will flow faster? Water. Why? So any conditions which thickens the blood or narrows the blood vessels can lead to problem of erection. Agreed? Yes or no? What are the conditions that lead to atherosclerosis? Scotch, smoking, sugar. So all three acids are not good for the big acids. Moreover, you can also advise, there are no muscles in it, so question of weakness doesn't arise. There is no bone fracture cannot occur. In such conditions, suppose if a patient has got mild vascular problem, erectile dysfunction. Please remember, penile blood vessels are the smallest blood vessels. So if at all erectile dysfunction occurs, you should take this as a signal for a cardiac problem after 5 or 6 years. It is proved. Because penile blood vessels are the smallest and then comes heart. Here the patient will come and report to you, doc, I have desire. I do get erection, but kabhi kabhi barabar nahi hota hai. Suspect, get the lipids done, get that sugar checked out, advise him all the preventive sort of things. Still it persists, you can advise him something like sildenafil, which is safe. Sildenafil is Viagra-like tablet, and it is safer. One tablet of 100 milligram needs to be taken 1 hour before the act, once in 24 hours, preferred on the empty stomach. And as per your pharmacologist here, Dr. Pawar, who mentioned that films are superior and faster acting than the tablets because it passes the first bypass. Am I right? I have not had any personal use. He had, so he commented to me. And I value his comment as a good friend and a handsome face. So this is one. Second thing is that mainly what we call the value of semen. You are aware that there are two testicles. In testicles there are two varieties of cells, one secretes hormone, second the sperms which travels via the sperm duct, goes out, comes to the prostate and through the urethra, they come out. Well, is semen, and it comes out as semen. Is semen vital? Is semen important? Barring conception. Is semen important? Just let there be lights on this thing, please. We are going to have only theory, isn't it? Let the light stay. Yes, she confirms that there is theory, no practical. Yeah, is semen important? If yes, why? If no, why? Sorry? Lubricating fluid? Nutritive fluid? 15 calories, madam? You call it nutritive? Lubricating? You say nutritive or lubricating? Both. So nutritive, please give the nutritive as well as lubricating. But you require lubrication after the sex act? No. पर वो तो फीमेल वजाइना में तो ऊपर स्पर्म runs with 70 miles per hour speed on the contrary. हाँ जी हाँ जी क्या होता है
So river, in a river we have boat, semen, sperm. River is to boat, is to semen, is to sperm.
river
Boat is equal to semen is to sperm.
माने न्यूट्रिटिव भी है और लुब्रिकेशन भी है, ठीक है, उसके लिए वाइटल है. एनीथिंग एल्स?
So river के flows in boat.
अच्छा ठीक है. Yes, semen is a great vehicle. Agreed. Agreed. 3 cheers for this young lady. Well, semen is vital and therefore should be conserved is a misconception. Conservation of semen is essential for robust health and athletic excellence is another misconception. 1 drop of semen equals to 100 drops of blood and 1 drop of blood equal to so much of food is a third misconception. There are 2 varieties of cells in the testes. One secretes hormone which goes in the blood. Because of that you get moustache, beard, hair from chest, hair from eczema, hair from the pubic region and desire for sex. Well, when this particular thing goes down, remember, andropause is not like menopause. There is no sudden decline of testosterone in males. It's a gradual affair. But if you find that there is consistent reduction of the semen, keeping both the orgasm constant, and if repeatedly if the seminal quantity is low, you can advise the diet which is rich in testosterone. Which diet contains high testosterone? Anybody? Yes? Sadadi, you have it every day, you don't know? Urad kadal and fenugreek, methi, contains rich amount of testosterone. Well, second thing is that which manufactures sperms every minute, about 50,000 sperms are manufactured. And when a man ejaculates once, he brings about 100 crores of sperm. And how many you require to produce a child? 1. If all would have fertilized, you could have had 1 India every day. Please remember, the sperms which you see, you can't see with the naked eye. You need a microscope. And never advise a semen examination in a case of impotence. Because sterility and virility are 2 entirely different things, depend upon the different types of cells present in the testes. So never advise semen examination. Even if you don't have a single sperm, your performance is not going to be affected. But 99% of the seminal fluid is secreted by the seminal vesicles and the prostate gland. Less than 0.1% contributes to the sperms. This is being manufactured day in and day out. If you don't remove it, you go out by itself. Here comes the myth about sleep remission. We write a lot of medications. No, I would never prescribe a medication for a problem of sleep remission. Explain to the client that sleep remission is normal, physiological and not pathological. I give an example. There is a glass full of water. If I add more to it, what happens? It overflows. Similarly, if you don't indulge in intercourse or masturbation, it comes out as sleep remission, which is normal, physiological. You don't need to consult a doctor for this. You see, you can't check your urine for indefinite time. You can't check your stools for indefinite time. Then people will say, what are you talking about? What about brahmacharya? I am a Jain. What about brahmacharya? I am a Jain. Yes, brahmacharya exists. But brahmacharya does not mean holding the semen. No. The real meaning of brahmacharya is Brahma means Atma, soul, and Charya means in search of. So in search of soul is brahmacharya. It is not holding of semen. So the entire meaning has been distorted. Sometimes patients will come, doc, I ejaculate very fast, and that's why I can't do my prayer. Hindus and Mohammedans both. In Mohammedans, they can't do their prayers, they can't do namaz. बोलते नापाक हो जाते हैं. Here under this impression that this is semen. This is not semen. This is Cowper's gland fluid. You see, just explain to them that this is Cowper's gland fluid. When you see a sweet, you get salivation in the mouth. Similarly, when you see a pretty girl, you might get salivation from the penis, a drop or two, which oozes out, which does not squirt out, which is colorless, sticky, unlike semen, which is just 1 or 2 drops, unlike 2 or 3 ml of semen. Just make it very clear. But people worry here. People don't worry here. They worry here. Why? Right from the childhood, if you touch at the nose, mouth, no one bothers. But the moment you touch at the private part, in my house or your house, everywhere, sure, it's dirty. That means right from these days, these ideas have been implanted in our mind that this is something special and anything coming out of it special. In fact, there is nothing so special about it. It's just like any other organ of the body. Another thing, you must have come across something known as Dhatu syndrome. Am I clear? You must have come across in your practice. पिशाब के रास्ते से धात जा रहा है. धात माने पिशाब के रास्ते से सीमेन जा रहा है. A very, very common condition. Almost every third patient would come. Anybody? Have you heard of this or not? How do you solve it? We prescribe some of the other medication. Listen to this. Yeah? Sorry? What? How do you counsel them? Sorry? I understand phases of counseling, but how do you counsel? What is the crux? What is this that according to you?
It's semen.
It's semen. America discovered Columbus.
They think it as dhatu, means something very precious. So
Then according to you it is not precious? Madam, you can only counsel if your fundas are clear, not otherwise. ये भाई बंद हो गया है इधर का. Anybody? Look here. Look, this is the urethral gland fluid, not semen. First of all, when you pass semen, the urinary door closes, then and then you can pass semen. Clear? This is the urethral gland fluid. And when you sit like this and do a little force, the pressure would be exerted on this side. And if there are 10 drops of perspiration here, and when the 11th one meets, it falls down. Same thing happens here. People worry here, they don't worry here. But this problem is only found in Hindustan, Pakistan, Afghanistan, Baluchistan, Turkestan, and not during my stay in UK or USA. I haven't come across a single case. Do you know why? Just think. यहाँ पर लोग उकड़ू मार के बैठते हैं ऐसे और देखते हैं क्या गया उधर लोग क्या देखते हैं तो ये देखा फंस गया ये नहीं देखा बच गया I had my original research on Vatsyayana. Who was Vatsyayana, which place he belonged to, and when he wrote Kama Sutra. That was my research on which government gave me personally. Another research was on orgasm, where I gave new classification to the world. Till that time, women in this world were not having diagnostic labels for orgasmic dysfunction. But if you ask me, which research has helped me and my countrymen the most? This particular. उसके बाद भी थोड़े टाइम तक you might need to, now you can counsel effectively. But if you are thinking this is also semen or this is also semen, वो बात करने से थोड़ा बहुत फर्क पड़ता है, लेकिन रूप doesn't. कई बार अपने को लगा कि पेशेंट अभी नहीं आ रहा है, क्योर हो गया, नहीं वो बाजू की दुकान में गया होता है. The female was not had sexual intercourse, she has hymen. Second, the woman who had sexual intercourse, she doesn't have hymen. And third, the woman never had sexual intercourse and yet she doesn't have hymen. What I want to tell you is that hymen is not the test of virginity. A woman need not bleed at the first attempted sexual intercourse. I've come across several patients, पहली रात को. The husband, they are worried about hymen. Where is hymen? Where is hymen? किधर गया? किधर गया? I mean, they are worried about this small tissue and make a big issue out of it, So please remember, bleeding at the first attempt is not necessary. Penis size, penile length and width have been the yardstick by which man has measured his manhood and had his manhood assessed by his friends and wives. But penile length and width changes from one individual to the next, as to the length of the noses, the width of the forehead, and the size and spacing of the eyes. Well, anybody in the audience, what is the normal size of the penis? 10 to 15 centimeters. Any other view? But I want the audience to participate here. 13 inches, I am talking about a human being and not an animal. Please remember, it is not compulsory to reply. 4.5 to 5.5. Never impose your own values on clients. Please remember that. कुछ लोग यहाँ ऐसे देखते हैं as if they are fantasizing कि क्या हो रहा है वो तो क्या. Thank you for giving me wonderful answers. I remember this. This is the frontal view of the female genitalia and this is the cross section of the lateral view. The outer lip. Maximum sensations are outside and outer 1/3 of vagina. The normal sexual length of vagina is 6 inches. I don't know why people feel that Alexander the Great and Genghis Khan were endowed with longer penis and therefore sexually more potent. This particular strong warrior had just a 3 inches penis but was a perfect performer in bed. Why? This is the frontal view of the female genitalia, cross section of the lateral view. Vagina is the common passage for intercourse, birth and menstruation. Maximum sensations are outside and outer third of vagina. This leads us to two conclusions: that if you want to arouse your partner, concentrate on the area of maximum nerve endings. See, we are living in the era of time management, so don't waste time inside. And second, the size of the penis could be anything from 2 inches or more. Longer the better is the Godzilla logic. I was writing column in English midday here. I received a question, myself and my daughter, who is a relationship counselor practicing in Pune. We were just writing a column together. Some question came that I am a rich diamond merchant. I want to increase my penis size instantly at any cost. I am prepared to spend any amount of money. Diamond merchant, instant increase in the size of penis, prepared to spend any amount. I had to reply that the magnifying glass which you are using for your but at the end I made a note as precaution: please do not use in direct sunlight. How a woman gets wet, either with a sigh, or a taste, or touch, there is a sex center in the brain. When it is aroused, the messages are relayed down, messages go down, there is flow of blood in the entire body, and a woman gets wet. Well, when she is aroused further, she reaches what is known as orgasm. This reminds me of a case that a famous Pakistani lyric writer was referred to me by a singer here in Bombay named Ashok Khosla in Jagjeet. Came and he had a girlfriend of 1/4 of his age. I was taking the history में तकलीफ क्या है? तो लड़की ने बड़ा अच्छा बताया है। डॉक्टर साहब, मेरा इस्तेमाल एक नींद की गोली की तरह हो रहा है. What she meant was, after husband used to finish very fast, and after that the girl was left alone. She was not satisfied. तो मैंने कहा जरा खुल के बताओ. So she was also feeling shy, being a Pakistani female. तो डॉक्टर साहब, वो भी शायरा थी. तो डॉक्टर साहब, बात कुछ ऐसी है कि वो तो नहा के चल दिए और लहरें तड़पती रह गई. I am very passionate and very fond of ghazals. I can give an entire lecture on sexuality and ghazal, which I gave last week in Surat in the orthopedic conference. I am passionately involved on both passion and ghazal. So whenever you feel like hearing, tell me on any aspect, I'll be able to recite, right from homosexuality to orgasm. Am I clear? And when the woman reaches the peak, she experiences what is known as orgasm. What happens when a woman reaches orgasm? Why? It's important. How much time do we enjoy orgasm? Come on, you are all medical students. How much time do we enjoy orgasm? Don't ask her, that lady in the green. Don't ask her. Come on, how much time do we enjoy orgasm?
1 hour.
Sorry?
1 hour.
1 hour a day? You can fantasize, because fantasies are always more colorful than reality. You see, How much time do we enjoy orgasm? Not more than half a minute per week and not more than half an hour per year. But still, it's an important phenomena. The mathematics of misery and happiness chiefly depends upon this.
But there are multiple orgasms.
How many multiple orgasms? Not in men, in women, yes. Women are multiple orgasms. Agreed. But how many women? How many women you have come across who are multiple orgasms? Come on.
I just heard like this multiple.
Very, huh? Yes?
So maybe 15 to 20.
15 to 20. Orgasm?
Yeah.
No. The highest recorded orgasm was 13. This was in a book published in 1990 by Dr. Prakash Kothari, Orgasm News. There I recorded ECG, EEG and hormone profiles during multiple orgasms. Please remember, very nice, to be multi-orgasmic for a woman is an inbuilt thing, but for a man it's an acquired art. In my office, women coming with multi-orgasm capacity about 10 to 12%. But tell me what happens when a woman reaches orgasm. Multi-orgasm to baad mein aayega. What happens when a woman reaches orgasm? They are dispensable pelvic physiological concomitants. Not a must. Only 2 out of 10 females would get contraction in the outer 1/3. I know you have read Masters and Johnson and this is a theory behind it.
So,
Yeah?
so there's a libido graph, not like for male, it's a
Yes.
So like-
End up.
so
What's
like-
your name?
So my name is Subramanyam.
Sorry, so Sundarajan.
Subramanyam. So like my show in 12th had told us ki
My?
so biology, so
What's your sir, lady or gent?
male gents.
Gent.
So he had taught us, like he was just like we were in a conversation, so he told us that
Just theory.
Yeah. in a male,
देखो ना, कभी भी तुम बात करते हो ना पेशेंट के साथ ऐसा ऐसा तो ऐसा मत करो। हाँ। वो उसने किया होगा पर कि आप मत करो। तुम्हारे पीछे भी लोग हैं, आगे भी लोग, पीछे वाले देख सकते हैं, यहाँ आगे वाले तो नहीं देख सकते।
so in a male the libido graph is like a bell curve, and in a female it goes ऐसा and like it goes up, it is a peak, and then it follows, it goes up and up and up, and then there's a constant plateau phase and then it goes down.
अगर आप ऐसा सोचोगे ना, it will be a more work and less pleasure. You are right. Master Johnson ने लिखा है कि whenever a woman reaches orgasm, उसकी pupils go little wider, the nipples protrude 1/4 inch, the whole thing becomes little rest you get. My dear friend, ये देखने को जाएंगे तो you will have only work and no pleasure. You will be lost. Sex is not. What है? अरे गुजराती लड़की है तो पूछना पड़ता है. તમને સંતોષ મળ્યો મરાઠી આજ તો મારા વિચારતા પાहिजे સાહેબ કે તમારા સમાધાન હોતે का पंजाबी आई use the word तसल्ली, तमिल they use the word तृप्ति, तेलुगु they use the word संतृप्ति. There was a female from झोपड़पट्टी came to me. जब साहब हमारे शौहर जल्दी खत्म हो जाते हैं और हम नशे में नहीं आते हैं. She was comparing orgasm with intoxication. Whatever there is an orgasm, is an orgasm, is an orgasm. If a woman has had one, she knows about it. Otherwise, any attempt to explaining is like explaining a rainbow to a blind man. Ask only one question. Did you get feeling of enough and nothing more? If she said yes, she had orgasm. If not, you need to work harder. Remember, women do not ejaculate as men do. Men, either by the sight, odor, taste or touch, there is a sex center in the brain. When aroused, the messages are relayed down. When the message is sufficient, further messages go down. There is flow of blood and a man gets erection. Messages are less, he may not get proper erection. More than enough, he may come very far. Moreover, Usually some men are attracted towards the opposite sex, some men are attracted towards the same sex. So homosexuality cannot be treated. Please remember that. If a homosexual is satisfied in a positive way, he is better off than not satisfying at all or being a heterosexual one. If a homosexual is satisfying his relationship in a positive way, he is better off than not satisfying at all or being a destructive sexual one. Homosexuality is genetic. You can't change it. I normally ask 3 questions: fantasy, dream, and physical encounters. If in all these 3, if they are only made same sex, then he is a pakka same sex person. You can't change it. As you grow older, you walk slow, you talk slow. I mean, barring Prakash Kothari. I mean, you walk slow, you talk slow, but you expect that erection should not be slow. Well, from here to the gate, you may not be able to run that fast, but you will be able to walk that much fast at any age. I mean, walk that much distance at any age, provided you are in good physical health and there is no psychogenic blockage. But while walking, suppose you are worried, hoga ki nahi, so nahi hoga. The moment you focus more attention, it will have an inhibitory effect. And the moment you forget about it, it will come automatically. एक बार फेल हो जाने के बाद होगा कि नहीं होगा, ये बात नहीं होनी चाहिए. Are you breathing now? Are you breathing now? Are you breathing now? Yes. Formerly you were not aware. Now you became aware. So the moment you focus more attention, it will have an inhibitory effect. And the moment you forget about it, it will come automatically. The point is, you can't be anxious and sensuous at the same time. And occasional failure in sexual performance does not mean an end to sex life. In first inning, Virat Kohli can get out in 0. But in second inning, he can score 129 not out. Please remember that. So failures are common. Failure does not mean an end. Another myth that sex after 60 is not possible needs to be changed. In fact, this could be the golden years of sexuality because there is enough affection, warmth and understanding after having spent a lifetime together. Sex has no expiry date if there is a good understanding partner and no psychogenic drama. Instead of understanding these people resort to sex tonics. What are sex tonics? A belief in magic food and drugs to stimulate sex and sexuality is a delusion as old as the human race. Almost every culture has attributed some part of sexual arousal to some variety of food or drug which resembles very remotely to the male phallus, like carrots or asparagus. It has been proved beyond doubt that there are no such food or drug available on the earth today which is directly sexually stimulating. Either it alters the mental state, alcohol, charas, ganja, afim, cocaine, bhang, increases the flow of blood, your himbe, or irritating the mucosal passage, Spanish fly, a variety of insect, dried and heated until it forms disintegrates into form to a fine powder, which is taken with the drain passes and changed into the urine and leads to a reflex erection. Margin between the therapeutic and the lethal doses very, very narrow. By and large, in my experience about the herbal tonics, whenever a tablet is given, it's a picture of a Himalayan horse that works, not the tablet. If an injection is given, it's a prick of the needle that works and not the contents of the syringe. If you ask me to sum up in one sentence about this sex tonics, it is the exploitation of the desperate by the ignorant. Well, human understanding Empathy and offering of the adequate sex knowledge are the most powerful remedies, and the value of which tends to be neglected in this modern age. In my opinion, their increased application could obviate the majority of the use of tranquilizers and the so-called sex tonics. Much has been omitted in this talk that might have been included, and it is fervently hoped that nothing has been included which ought to have been omitted. I thank you.